Thank you so much for trusting us with your oral surgery care. We want to provide you with the highest level of care, and we hope to make your recovery after surgery as easy as possible.
In order to optimize your healing, we want to go over how to best take care of yourself after your surgical procedure.
So let's go over some post-operative instructions that will be useful for you to know.
All right, we put this piece of gauze in here open.
First things first, gauze. For most procedures, you'll leave the office biting on gauze applied to the surgical site in order to prevent bleeding and initiate the clotting process. Keep this gauze in place for 30 minutes with continuous biting pressure. After 30 minutes, take a new square of gauze, fold it in half until it forms a small cube, and switch it out with the old gauze directly over the surgical site, and then bite down on it firmly. Repeat every 30 minutes until the bleeding has subsided, which usually happens after 2 to 3 replacements. You can get more gauze at your local pharmacy if you run out. Biting on a tea bag moistened with cool water will also work. Do not spit, as this will disrupt the clotting process.
Today and tomorrow, remember to play it cool. To minimize swelling and discomfort, apply ice packs to the surgical sites when you get home. A bag of frozen peas or a Ziploc bag filled with ice works great for this. Apply ice in a schedule of 20 minutes on, 10 minutes off, as much as possible today and tomorrow. After that point, ice may be used to help with discomfort, but it's usually no longer effective at preventing swelling.
Let's talk about keeping your mouth clean. Don't brush your teeth until later this evening after all the numbness is worn off. Once your mouth is no longer numb, you can gently brush your other teeth as best as you can, but make sure to avoid the surgical sites. Before bed, you can also begin gentle oral rinses with Listerine, Scope, or a prescription mouth rinse if you were given one.
Now you're probably thinking, I'm hungry. After surgery, you can have your first food and drink once you take your first set of gauze out. Start with something easy, like a smoothie or a milkshake, but don't use a straw for the entire week after surgery, as the suction force can disrupt the clotting process. Instead, drink directly from the cup, or use a spoon to eat the smoothie or shake. From there, you can progress to any soft foods, such as overcooked pasta and noodles, soups, mashed potatoes, scrambled eggs, ice cream, jello, pudding, applesauce. But be sure to drink plenty of fluids to maintain good hydration.
While you're still numb, be careful with hot foods and drink so that you don't burn your lips or tongue. Continue this soft diet for about 5 days, and then you can slowly ease your way back into a more regular diet. Make sure to continue to avoid any crunchy or granular foods such as fruits with small seeds, chips, rice, nuts, and popcorn for 2 weeks after surgery.
You know how you just want to relax sometimes? Well, now's your chance. After your surgery, try to take it easy and rest as much as possible for the remainder of the day. When laying down during the first 48 hours, try to keep your head elevated above your heart to help minimize swelling.
Over the next few days, feel free to do any mild activity that you feel up to, depending on your recovery. Try to avoid heavy exercise for 1 week after surgery so as not to disrupt your healing.
You should also try to avoid smoking for 1 week after surgery, as nicotine and the suction force can disrupt the healing of your surgical sites.
Okay, that's it. We hope you found these tips and instructions helpful. You'll be given a written version of these instructions for reference, and you can also find this video on our website for additional viewing.
And if you have any questions at all during your recovery, please don't hesitate to contact us by calling the main office.
We're available by phone 24 hours a day, and we're always here for you.
Thank you again for trusting us with your oral surgery care. We wish you a quick and easy recovery.